When it comes to sexual performance, one of the most common questions men have is, how can I last longer in bed? It's a question rooted not just in physical curiosity, but often in emotional concern about satisfaction, confidence, and intimacy. As a urologist and pelvic surgeon, I've had countless men ask this question, and my goal is always to help them understand that lasting longer is not only about endurance, but also about communication, awareness, and overall sexual health. Before we talk about solutions, it's important to first understand what lasting longer actually means. Many people underestimate how brief the average duration of penetrative sex really is. According to research, the average time from the beginning of vaginal penetration to ejaculation is around 5.7 minutes. That's completely normal and healthy. Yet, surveys show that many people believe sex should last between 7 to 13 minutes, a difference shaped more by media culture and expectation than by biology. If you and your partner are satisfied with your current level of intimacy, there's no medical need to change anything. Sexual pleasure is deeply personal and depends on far more than duration alone. However, if you or your partner feel dissatisfied, frustrated, or anxious about how quickly ejaculation happens, that's when it becomes worth exploring. Sometimes the issue lies not in the body's physical function, but in a mismatch between expectations and communication. Talking openly with your partner about what feels good, whether that includes penetrative sex, oral stimulation, manual touch, or sex toys, can often lead to more satisfying experiences without any medical intervention. That said, when ejaculation happens sooner than desired and causes distress, we refer to it as premature ejaculation, or PE. This is a common condition. About 30% of men experience it at some point, but only about 9% actually discuss it with their doctor. Many men suffer in silence, feeling embarrassed or believing it's something they should fix on their own. But PE is not a reflection of masculinity, virility, or emotional strength. It's a medical and psychological issue that can often be successfully managed with the right tools and understanding. Clinically, premature ejaculation is defined by three major characteristics. The first is ejaculating within 1 to 2 minutes of vaginal penetration. The second is the inability to delay ejaculation during most sexual encounters. And the third is that the issue causes distress, such as anxiety, frustration, or relationship strain. PE can be classified as either primary, meaning it has been present since a person became sexually active, or secondary, acquired, meaning it develops after a period of normal sexual function. Secondary PE often occurs suddenly and can be linked to changes in mental health, hormonal balance, relationship dynamics, or other medical conditions. So what causes this to happen? The answer lies in both the brain and the body. Ejaculation is actually a reflex, an automatic process triggered by stimulation and coordinated by an area in the spinal cord known as the spinal ejaculation center. When physical stimulation occurs, signals travel from the penis to the spinal center, which then communicates with the brain to determine when ejaculation should occur. One of the key players in this process is serotonin, a chemical messenger that helps regulate mood and bodily functions. In men with PE, certain serotonin receptors that help delay ejaculation may not function properly, making it harder for the body to hold off on that reflex. This neurological explanation often comes as a relief to men because it helps separate the issue from guilt or shame. It's not all in your head, nor is it a lack of willpower or experience. It's a physiological process, just like how some people's blood pressure runs higher than others, or how some people are more sensitive to caffeine. Understanding that premature ejaculation is a reflexive process influenced by neurochemistry helps shift the conversation from blame to treatment. Of course, PE can also have emotional components. Stress, anxiety, depression, or even guilt can all influence arousal control and satisfaction. In my clinical experience, I often see a cycle where anxiety about performance leads to faster ejaculation, which then increases anxiety even more. A frustrating loop that many men find difficult to break. Recognizing and addressing these emotional triggers is just as crucial as treating the physical side. The good news is that premature ejaculation is highly treatable. Many men find relief through behavioral techniques, therapy, and in some cases medication. Before any treatment begins, however, I always emphasize that there's no need for lab tests or invasive diagnostics. PE is what we call a clinical diagnosis based on discussion, not tests. Your doctor will ask about your medical history, your typical sexual experiences, and how the issue is affecting your emotional and relational well-being. From there, you can begin exploring solutions tailored to your needs, solutions that not only improve performance, but also enhance intimacy, confidence, and connection. So if this is something you or your partner are struggling with, know that you're not alone. The first and most powerful step toward improvement is understanding, and that's where we'll begin to build the foundation for lasting change. In the next chapter, we'll explore the available treatment options from behavioral strategies and topical therapies to prescription medications so you can make informed choices about what's best for you in your relationship. Once a man begins to understand what's really happening in his body during premature ejaculation, the next step is to explore practical, evidence-based solutions. And thankfully, there are many. The key is to remember that treatment is not one size fits all. What works beautifully for one man may not be as effective for another. The right approach often combines physical, psychological, and relationship-focused strategies because sexual function is influenced by both the body and the mind. The first line of treatment I often discuss with patients involves psychotherapy or sex therapy. This may surprise some people, but emotional and psychological factors, such as anxiety, guilt, or relationship tension, can significantly affect sexual response. When a person feels anxious about performance, it activates the body's fight or flight response, which can interfere with the natural sexual reflex and speed up ejaculation. Working with a trained psychotherapist or certified sex therapist helps identify and break these patterns. In fact, studies show that men who combine therapy with medical treatment can increase their time to ejaculation by up to 8 times compared to those who only use medication. Therapy helps rebuild confidence, improves communication between partners, and reduces the fear that often drives premature release. Behavioral techniques can also be extremely effective. One of the most time-tested methods is the stop-start technique. This involves a man or his partner stimulating the penis until he feels close to climax, then stopping until the urge to ejaculate subsides. Over time, this helps retrain the ejaculatory reflex to delay release. Another variation is the squeeze technique, where gentle pressure is applied to the penis just before climax, reducing arousal and helping regain control. These methods require patience and practice, but have proven benefits when done regularly, ideally 3 times a week or more. In some cases, men benefit from working with a pelvic floor physical therapist. These specialists can help you identify and strengthen specific muscles that play a role in ejaculation control. By learning to engage and relax the pelvic floor muscles at the right times, many men experience better awareness and voluntary control during sexual activity. When behavioral and therapeutic approaches alone don't provide sufficient improvement, topical or medical therapies can be added. One of the most common and accessible options is the use of topical anesthetics, creams or sprays that reduce penile sensitivity, helping to delay ejaculation. These products numb the nerves on the surface of the penis, reducing the intensity of stimulation without eliminating pleasure altogether. One clinically proven product I often discuss is Promescent, a topical delay spray that can be purchased over the counter in the United States. Unlike many unregulated products found online, Promescent has undergone clinical studies and demonstrated measurable benefits. In one study conducted by researchers at the University of Kentucky, men who used the spray increased their average time from penetration to ejaculation from about 6.5 minutes to 11.5 minutes, nearly doubling their duration. Even more encouragingly, the rate of orgasm among both partners increased from 44% to 66%. This shows that prolonging intercourse can enhance satisfaction for both people, not just the partner who struggles with PE. Promescent uses a metered dose spray, meaning each spray delivers a precise, consistent amount of numbing agent. You typically start with 3 sprays to the head of the penis about 5 minutes before intercourse and can adjust the amount depending on personal sensitivity, anywhere from 1 to 10 sprays per use. The formulation is eutectic, meaning it combines 2 substances that dissolve into an oily mixture without needing additional solvents. This allows for faster absorption and minimizes transfer to your partner, so there's little to no risk of them experiencing numbness. Of course, there are prescription options as well. In the United States, EMLA cream, which contains lidocaine and prilocaine, is sometimes prescribed off-label for PE. In Europe, a product called Forticin is officially approved for this purpose. Both contain similar numbing agents and can be applied about 15-20 minutes before sex. However, they need to be washed off before intercourse to avoid transferring the medication to your partner. Some men experience mild irritation or temporary numbness, but overall, these medications are well tolerated and can be very effective. Another class of treatments that often surprises people is antidepressant medications. These are not prescribed because of depression, but because of how they interact with serotonin, the same neurotransmitter involved in ejaculation. Certain antidepressants, known as selective serotonin reuptake inhibitors, SSRIs, increase serotonin levels in the brain, which in turn can lengthen the time to ejaculation. Common SSRIs used for this purpose include fluoxetine, sertraline, and paroxetine. These are usually taken daily, and it may take 1 to 2 weeks before their effects on ejaculation become noticeable. However, these medications do come with potential side effects, including mild nausea, fatigue, or temporary decrease in libido. In most cases, these side effects fade within a few weeks. Some men prefer on-demand medications that are taken only before sexual activity, such as clomipramine, a tricyclic antidepressant that also works by enhancing serotonin and norepinephrine activity. This can be taken 2 to 6 hours before sex and has shown significant improvement in delaying ejaculation in multiple studies. Outside the US, another option is duloxetine, a short-acting SRI designed specifically for premature ejaculation. It's taken 1 to 3 hours before sexual activity and works quickly with fewer long-term side effects since it's not taken daily. Unfortunately, duloxetine is not currently FDA approved in the United States, though it is available in many other countries. If premature ejaculation occurs alongside erectile dysfunction, addressing the erection issue first is essential. Medications such as sildenafil Viagra or tadalafil Cialis, which increase blood flow to the penis, can help maintain a firm erection and indirectly delay ejaculation. When the erection is strong and consistent, it reduces anxiety and allows more focus on arousal control. There are also some less common off-label therapies. For example, tramadol, a mild opioid pain medication, has been shown to delay ejaculation when taken 1 to 2 hours before sex. However, because it carries a risk of dependency and side effects such as nausea, dizziness, or drowsiness, it should only be used under strict medical supervision. Another option is alpha blockers like tamsulosin or silodosin, typically prescribed for men with enlarged prostates. These medications relax the muscles around the prostate and bladder neck, and in some studies, they've been shown to help delay ejaculation. However, they can also cause retrograde ejaculation, where semen flows backward into the bladder instead of out of the penis, a harmless but sometimes disconcerting side effect. As you can see, there are multiple layers of treatment, from therapy and physical exercises to topical and prescription options. The most effective approach usually combines several of these methods. For instance, a man might use a topical spray while practicing the stop-start technique and attending sex therapy sessions with his partner. This holistic strategy not only addresses the physical aspect of ejaculation control, but also improves communication, intimacy, and overall sexual confidence. Premature ejaculation can feel isolating, but it's one of the most treatable conditions in sexual medicine. With patience, professional guidance, and the right combination of treatments, most men can see significant improvement, often within weeks. In the next and final chapter, we'll talk about how to maintain these results long-term, including lifestyle changes, emotional strategies, and how to nurture a more satisfying and connected sexual relationship. By now, you understand that premature ejaculation isn't just about the physical reflex of reaching climax too soon. It's a complex interplay between your body, your brain, and your emotions. The encouraging truth is that once you learn how these systems work together, you can train yourself to gain more control and confidence in the bedroom. The final step, then, is to focus on maintaining progress, strengthening your overall sexual health, and reconnecting with your partner in a way that makes intimacy more fulfilling for both of you. One of the most overlooked aspects of lasting longer in bed is mental conditioning. When I talk to patients who have struggled with premature ejaculation, I often find that anxiety plays a big role, specifically performance anxiety. When you start to worry about finishing too soon, your body's natural stress response kicks in, flooding you with adrenaline. Adrenaline is great when you need to run from danger, but it's not your friend when it comes to sexual performance. It raises your heart rate, tightens muscles, and triggers a premature ejaculatory reflex. The best way to counter this is by consciously relaxing both your mind and body before and during sex. Techniques such as deep breathing, mindfulness, and grounding exercises can help redirect focus from fear to sensation. Instead of thinking, don't finish too early, shift your mindset to, oh, enjoy this connection. That subtle change can make a profound difference in how your body responds. Communication with your partner is another crucial part of maintaining long-term success. Many men feel embarrassed to discuss premature ejaculation, which can create distance and tension in a relationship. But intimacy thrives on honesty, talking openly about what feels good, what doesn't, and how both of you can make adjustments together not only relieves pressure, but also builds emotional closeness. Sometimes couples discover that the issue isn't the duration of intercourse itself, but a lack of variety in their intimate routine. Mixing in foreplay, oral stimulation, or mutual touch can help shift focus from performance to pleasure, making sex more enjoyable overall. Your physical health also plays a huge role in maintaining control and stamina. Regular strength training and cardiovascular exercise improve blood flow, hormone balance, and energy levels, all of which support healthy sexual function. Specifically, pelvic floor exercises or kedgels for men can be extremely helpful. These exercises strengthen the same muscles that you use to stop the flow of urine midstream. By tightening and relaxing these muscles regularly, ideally 3 sets of 10 repetitions per day, you can enhance your ability to control the timing of ejaculation. Studies have shown that men who consistently practice pelvic floor training experience a significant increase in ejaculatory control and sexual satisfaction. Another key element is sleep and nutrition. Testosterone levels, which influence libido and stamina, are closely tied to your sleep quality. Men who consistently get fewer than 6 hours of sleep per night often experience lower testosterone, higher stress, and decreased sexual endurance. Aim for at least 7 to 8 hours of quality rest per night. When it comes to nutrition, focus on foods that support cardiovascular and hormonal health. That includes lean proteins like chicken, fish, eggs, legumes, and plant-based sources, plenty of vegetables and whole grains, and healthy fats from nuts, seeds, and avocados. Limiting alcohol and avoiding smoking are also essential, as both can negatively affect nerve sensitivity and blood flow to the penis. If you're using medical treatments such as topical sprays, SRIs, or other medications, consistency and communication with your doctor are key. Many men make the mistake of stopping treatment too early, assuming that improvement means they're cured. But just like any form of physical training, maintaining gains requires ongoing attention. If you've found a treatment plan that works, talk to your physician about how to taper, adjust, or sustain it safely over time. It's also important to consider the emotional recovery process. Many men who've lived with premature ejaculation for years carry a heavy emotional burden. Frustration, embarrassment, or even shame, these feelings can persist even after the physical symptoms improve. That's why I often encourage patients to view sexual health as part of overall self-care. Building confidence doesn't just come from lasting longer. It comes from understanding your body, caring for your health, and fostering deeper connection with your partner. Self-compassion goes a long way. Instead of seeing premature ejaculation as a personal failure, think of it as a signal from your body that something needs attention and that it can be fixed. For couples, rediscovering intimacy can be a rewarding journey. Sometimes the process of addressing pee together reignites emotional connection and physical attraction that might have faded under the weight of anxiety or avoidance. I often recommend scheduling time for intimacy that isn't focused on penetration at all. Explore touch, sensual massage, and non-sexual physical affection. These activities release oxytocin, the bonding hormone, which promotes trust and relaxation. When your brain associates sex with closeness rather than performance pressure, your natural rhythm and control often improve. Looking at the bigger picture, premature ejaculation can serve as an opportunity, a chance to learn more about your body, your emotions, and your relationships. It teaches you patience, communication, and mindfulness, all of which enrich not just your sexual health, but your overall well-being. And it's worth emphasizing this is one of the most treatable sexual conditions in men, whether through behavioral techniques, medical therapy, or lifestyle change. There are effective, safe, and lasting ways to regain control. If you've tried self-guided methods without much success, don't hesitate to reach out to a urologist or certified sex therapist. We're here to help, not to judge. Many men delay seeking help for years, sometimes decades, because of embarrassment. But once they take that first step, they're often surprised by how quickly improvement happens. Even simple, well-targeted interventions can make a tremendous difference within weeks. Lastly, remember that sexual health is not about perfection. It's about connection. There will always be variability in performance, and that's completely normal. The goal is not to achieve an arbitrary number of minutes, but to feel comfortable, confident, and connected during intimacy. Your worth is not measured by how long you last, but by how you care for your body, your partner, and yourself. So if you're struggling, take heart. Help is available. Solutions are proven and improvement is absolutely possible. Focus on your physical health, strengthen your emotional resilience, communicate openly, and don't be afraid to seek expert guidance when needed. Sexual health is an essential part of your overall well-being, and you deserve to feel empowered and satisfied in this aspect of your life. As I always say to my patients and viewers, take care of yourself because you're worth it.